In January of this year, Honourable Speaker, sir, the Ministry declared a public health outbreak of Fiji, in Fiji of the HIV. We are now estimated 7,000 people. There are now estimated 7,000 people living with HIV, and the ongoing upward trend is deeply concerning. We are grateful that this budget allocates 10 million specifically to contain the spread of HIV. These funds will support expanded testings and counseling sites, especially in high-risk areas, public education and youth engagement campaigns, the phased introduction of needle and syringe programs aligned with global best practices. We also acknowledge the support of our partners, Australia, New Zealand, UNAIDS, WHO, the Kirby Institute, and all UN organizations in Fiji who are supporting us in this fight. However, this is not just a health issue, it is also a social and human rights issue. We must break the stigma, empower communities with accurate information, and stop discrimination to ensure that everyone, regardless of background, has access to prevention, care, and treatment. Today, I'm asking all of us in this August House and those listening into the televised parliamentary sessions to work together and act now before it's too late. Do not discriminate against those with HIV infections, but help them and support them to get the care that they direly need so that they can continue to be productive members of our community. In this financial year, we are pushing ahead with a review of critical health-related legislations with a number of anticipated to be submitted to Cabinet at the end of this calendar year. The legislations under review are the Burial and Cremations Act of 1911, Public Health Act of 1935, the Radiation Health Act of 2009, the Mental Health Act of 2010, the Nursing Act of 2011. The Ministry will submit the proposed revision for the Quarantine Act of 1964 and the Burial and Cremation Act of 1911 to Cabinet in September of 2025. These reforms are essential to ensure that the regulatory foundation of our health system is robust and supports current and future needs and international best practices. We acknowledge our health partners who are supporting the Ministry in this effort. We also intend to begin in the new financial year and with the support of the Office of the Solicitor General, the processes for the review of an additional number of legislations, which include the Food Safety Act of 2003, the Tobacco Control Act of 2010, Tobacco Control Regulations of 2012, and the HIV Act of 2011, as well as the establishment of new legislations to cover important health services such as the medical laboratory services in Fiji. Honourable Speaker, sir, this budget is providing a clear pathway and direction on government's intent for improving the health service and tackling the health challenges of our time. Every dollar allocated to the Ministry of Health and Medical Services must translate into cleaner clinics, better medicines, empowered health workers, and healthier communities. The Ministry is ready to implement, guided by values of service, equity, accountability, and care.